Hi, my name is Allison Ezzat, and I'm a physiotherapist and a fellow in the Canadian Academy of Manipulative Physiotherapists, or CAMPT-Certified. I've been a member of CAMPT for the last 15 years. One of the conditions that I treat a lot in my practice is knee osteoarthritis. Having completed a PhD in the prevention of knee osteoarthritis after joint injury a few years ago at the University of British Columbia. Today, I'm going to talk to you about 3 common myths associated with knee osteoarthritis. Myth number 1, osteoarthritis is a normal part of aging that affects older adults. Osteoarthritis is not a normal part of aging, and it currently affects 1 in 8 Canadians, and this includes many people in their 40s and 50s. Many of these younger adults with knee osteoarthritis have a history of previous joint injury, such as an anterior cruciate ligament injury. Unfortunately, at this time, after you've had the injury, there is no short-term treatments that you can do to decrease your risk of osteoarthritis. Myth number 2, if you have osteoarthritis, you should rest. While there is no cure for osteoarthritis at this time, we do have a high level of evidence showing that patient education and individualized exercise therapy can help to manage your condition, including reducing pain and improving function. This is because one of the main structures that's affected by knee osteoarthritis is the cartilage, which lines the surfaces of the bone and has the main role of absorbing shock and distributing pressure across the joint surfaces. However, cartilage does not have its own blood and nerve supply, so it depends on loading through exercise and physical activity to help to push nutrients and blood flow into the joint, acting almost like a sponge every time you take a step or do a movement with your knee. Myth number 3 is exercise will make my osteoarthritis worse. In fact, exercise will help to strengthen the muscles supporting the joint. Pain is a very complex phenomenon that's produced by your nervous system due to real or perceived threat. And in fact, pain during exercise with osteoarthritis is not a sign of damage. It is safe to exercise at a low to moderate level of pain. And over time, you will be able to progress your exercises and do more physical activity as your pain levels continue to go down. As a CAMPT-certified physiotherapist, I can help you get stronger, reduce your pain, and become more confident in doing the activities that you love. If you have osteoarthritis, I'd be happy to help. You can contact me at North Shore Sports Medicine Physiotherapy. Thank you.
CAMPT-certified physiotherapists have received internationally recognized training in hands-on therapy. We can help you get better, recover faster, and stay healthier. So if you want to stay active in the things you love to do, then look for this logo. For more information on how to find a CAMPT-certified physiotherapist, visit www.manitpt.org.